Hi, my name is Chelsea Isom, and I'm going to be presenting today my group's poster for our socioecological model. And we decided to cover ours on improving access to healthcare insurance for those who need it. This is an important topic for us to come together on, as we felt that it is just very prevalent in our society today. And we felt that it's affected many people in our nation. And so for us, this was a no-brainer that we wanted to go ahead and discuss this topic. Once we decided on the topic, we got to work and we covered the 5 stages, which were individual, interpersonal, organizational, community, and policy or public policies. So let's jump into some of the research that we found. The first is we're going to look at is individual, and if you take a look at our poster, you can see that we looked at barriers an individual might run into while trying to get access to healthcare insurance. Some of the barriers that we saw that were really common were high cost of care, inadequate or no insurance coverage, lack of availability of services, and lack of cultural competent care. So we kind of went through these, and then we decided to go ahead and look further at some strategies that could be utilized to improve healthcare access for these barriers. And these were things like increasing the measures of insurance coverage and access to clinical and oral health care, which required making higher quality insurances more affordable for those who need it. We looked at addressing disparities such as race, ethnicity, socioeconomic statuses, age, gender, that can affect their access to quality healthcare insurance. And we can utilize this by improving it by increasing employment of bilingual healthcare members and strengthen their anti-discrimination policies to a zero tolerance policy in these areas. And lastly, for that, we also looked at assessing the capacity of healthcare systems to provide services for newly insured individuals. So creating more jobs for healthcare providers, offering more telehealth visits, especially now during our pandemic. That is so important. And this allows providers to see more patients in a timely manner. So our next category that we looked at was interpersonal, and we took in some factors including family, social networks such as education, and also the workplace. So the first one I'll talk about is family. If you're under the age of 26 and claimed as a dependent, you can be added onto your family's health insurance policy. Many people actually don't know that, and they think that once they turn 18, they have to be dropped from their parents' insurance. And so a lot of people that go to college or move out think they can't have access to that health care because they're not on their parents' policy anymore, but they can. For those with low income or children, the children might be qualified through the Children's Health Insurance Policy Program, even if the family is not eligible for Medicaid. So that was an important one. And we took a look at social network education. Some schools offer healthcare plans to students, and most plans are basic insurance plans. For one example, we actually saw that EWU has teamed up with Multicare Rockwood clinics in the area to help provide eligible students with basic healthcare needs. So I thought that was kind of impressive because we have something right here in our community to help those at our university. We then took a look at social networks and the workplace, and there are some jobs that offer job-based healthcare insurances. Employers select and purchase a policy, then eligible employees and their dependents can use these policies that their workplaces offer. Normally, the employers share premium costs with the employee, which often could be more financially available and affordable. This was important. I know from personal experience, this is very helpful. We then went ahead and decided to take a look at organizational information, and we looked at different organizations that can help out for those who maybe help with copay assistance or having access to healthcare or treatment assistance, medication assistance, stuff like that. So some of the organizations that we found that can help included Aunt Bertha, the Health Well Foundation, the Patient Access Network Foundation, and then as well as Needy Meds. The Patient Access Network Foundation also goes by the PAN Foundation. How these organizations help, if you take a look at Aunt Bertha, they created a network that makes it easier for people to connect with social services in their community. The Health Well Foundation often helps people who need assistance with prescription copays, health insurance premiums, deductibles, coinsurances, pediatric treatment costs, and also travel costs. The Patient Access Network Foundation, the PAN Foundation, helps uninsured individuals get the medication and treatments that they need. And then lastly, Needy Meds provides information on healthcare programs by offering direct assistance and facilitating programs. I've actually personally had experience with the PAN and HealthWell foundations, and they are super, super helpful. You would just log on, you look for whatever category that you would fall into needing, whether it's a prescription or anything like that, and then you look and see if those foundations are open at that time. It is on a first-come, first-served basis for those two programs specifically, so it would be, you would have to kind of keep your eye open for it, but once you're in, it is so beneficial and helpful. Next, we looked at community and what individuals can utilize in their communities and how they can access them. Some of the ways that communities can help is like churches and organizations can coordinate and promote local charity care, the Broden-free clinic availability. Local medical societies can agree to predetermined hours and also pro bono treatments, visits, surgeries, etc. Per month, and then non-profit sponsored discount care at local medical centers. So we also looked at some pros and cons that were in contact with how community outreach works. And so one of the pros was an advantage of the community approach is that it's tailored to the efforts of your local area, which means it's not tailored, if we're here in Spokane, it's not tailored for people like over in Seattle, where it might be completely different, their needs compared to our needs. Some of the cons of the community outreach, though, is its limited reach for patients. Resources are used in healthcare services and not as much as advertisements, and limited services and hours of availability for care. Communities can do the following that I'm going to mention in order to help those with no insurance or poor insurance. And this could be assist uninsured individuals in enrolling in Medicare or Medicaid if they qualify, create a safety net model that have their goals of increasing revenues for clinics and providing care primarily for those that are uninsured, implementing donated care models, which work when safety net models are not strong. They require less financing and advocacy support from well-established medical societies. And then lastly, implement nonprofit funding models into the community to increase funds in the charity care. One of the last things that we went and took a look at was public policies and how those affect those that are uninsured, and what all kind of goes into them as far as factors and everything. So some of the factors that we came across were regulating of the homelessness, healthcare legislation, and community norms on the importance of health and healthcare needs. Some possible interventions that could be made in this is that government implementing housing programs regulated by community officials, enact policies that increase availability of affordable comprehensive health care insurance for currently uninsured or insured populations, and then pass legislation allocating resources to educate communities with high incidences of individuals with no health care insurance. If you take a look at the center of our poster, you would find a map of the state of Washington, and it kind of covers the uninsured populations in certain counties all across Washington state. We look at the lowest color being blue, and that was ranging between 8% and below as far as uninsured populations. And then the pink red, the deeper color on that map, is being the highest, sitting at 15% or above of uninsured populations. If we kind of take a little bit smaller look at Spokane County over on the right-hand side of the poster, we would see that according to the map in 2014, Spokane was sitting around 7.6%, so that is actually below that blue 8%, which is really good because that's only saying 7.6% is uninsured. However, 7.6% still is a pretty big number. We would want to see those numbers as 1 or 0 or less, because people deserve quality healthcare insurance and deserve to have access to quality health care. It shouldn't have to come at a cost for them to maintain a healthy lifestyle and get adequate care. So if we kind of look at the big middle of the map, we do see that those numbers are increasing, and we see that in a little bit more of a pink color. However, nothing in the state of Washington reached that deep pink-red color of 15% or above. So that was something interesting, I think, for all of us to see, is that as a state overall, we don't have a large section or county that is extremely uninsured. So there's still so much that we can do to increase and improve the access to healthcare insurance for those who do need it. New data is continuously and always coming out. We're still learning about, community needs and different states and counties and everything like that, and what their needs might be, because, some of the things that we mentioned in our poster are just factors and information that we felt could be useful and important. But healthcare isn't always just, well, this community is compared to this community or anything like that. It shouldn't be a choice. It should just be there for us to utilize and for those who need it to utilize it. Every community is different, and so are their needs. The one thing that isn't different, though, like I said, is the access to healthcare and the importance behind it. I'd like to thank you for taking the time to listen to my presentation, and if there are any questions, please let me know. Thank you.